webinar, working with community organizations. And today we have the lovely Professor Sloane Burke from California State University, Northridge. And she was previously at ECU, another PPE site. And then we also have Ronda Jones, also from CSUN, Northridge. And they will both be talking about their work, how they have worked with community-based organizations, and what things have worked and what things haven't worked. So just a reminder, if you have any questions, you can chat. Just use the chat in the bottom to ask anything or raise your hand, and then we can click on you. And we'll answer all questions at the end of this presentation. So I'll just have them introduce themselves, and then we can just go ahead and start the presentation from there.
Wonderful. Well, thank you, Denise. Welcome, everyone, and thank you for spending time during this, what probably is a busy week for you with finals and courses wrapping up. We're glad to have you. I'm Dr. Sloane Burke, and like Denise had said, I was the faculty advisor at East Carolina University, and I've recently taken a position back home and moved back to Los Angeles, California, and am now the faculty advisor for PPE with Ms. Ronda here at Cal State University Northridge. I've been teaching higher ed for 16 years, and I've been a program advisors for various organizations, everything from the Optometry Club to Eta Sigma Gamma Honorary Society for Health. But I find that the preconception peer education program has been the most rewarding thus far because of the good work that's conducted in the community, and having a model program and tied to the Office of Minority Health, and working with such talented young students. So it is fabulous to be here. Ms. Ronda, I'll let you introduce yourself.
Hello, everyone. My name is Ronda Jones, and I'm the president for PPE at California State University, Northridge. We're going to be wrapping up our first year for the PPE program at CSUN, and we've been doing a lot of exciting things. We look forward to the next coming year working with PPE again. And I am here as a source for all of the students to be able to talk to you guys peer-to-peer for any issues or concerns, questions that you may have about how we started our program, things that we've been doing, how to contact organizations and just develop those relationships. So please use me as a source. I am here.
Okay, great. Thank you, Ronda. So I will take it away. Well, you know, we start kind of with this quote from the Office of Minority Health and the PPE program, that we know that infant mortality rates among African American babies are twice as high as those of the general population, which is highly problematic and speaks to the good work that you're doing out there in the community to prevent this health disparity. Is something that should not be occurring in this day and age. We are the wealthiest nation and have the highest technology in most instances in healthcare, and so the prevention piece is so key, and that's what's so important that you as PPE educators are doing out there in the field. And you know, a key component of this is to build our network of community partners out there. You know, I think we get excited about campus initiatives. We know campus health and wellness, and we know how to do it fairly well normally on each of our respective university campuses, but it's how do we then now bridge into the actual community? You know, what is a community? What are our community connections and partnerships? And you know, how do we sort of bridge into those communities to reach our target population even further beyond just our current student population? So that's what we're going to explore today in a little bit more detail. So it's defined here, a community partner is a local group, agency. It might be even a faith-based partner or organization. Usually it can be a nonprofit with whom you work on a regular basis. For many of you, because you're students, you may not work with a faith-based partner or an agency in a more formal capacity, as you will hopefully moving forward. But it may be you're part of a church. You know, you might have done some service learning, maybe at the American Cancer Society or March of Dimes, and you never even thought, okay, I should take this even further for dissemination of PPE's public health education efforts. So again, a community partner, agencies and people in the community who directly touch the lives of citizens of your target population. It's not easy to reach a very targeted constituent that you're trying to reach. You know, if you're trying to reach a certain target population in terms of ages or ethnicity or, you know, a specific community. For example, here in Greater Los Angeles, we have at Los Angeles County, Antelope Valley, which is only about, you know, about an hour from us, has the highest infant mortality rates, some of the highest in the state, and definitely the highest in Los Angeles County. So how do we actually connect with that area of Antelope Valley, which is Lancaster, Palmdale? And it's through our community partners. We sort of don't walk in there and have access to a concentrated group of high-risk individuals. So that's sort of the key that we're looking at here in our community partners. So community partners play a vital role for your PPE program. Again, as I had said, to connect with the community. The key thing too that they offer is, and that we can offer them, but is trust, access, and resources. You know, partnering with a local agency, like I mentioned, March of Dimes, or maybe a you know, a faith-based organization or church, becomes very essential to, you know, they already have established trust, because this is an agency or organization that people are already attending or connected to in some way. So there's a great deal of trust and, again, access and sometimes resources. You know, you'll need rooms for health education, you know, for the PPE content. You know, you'll need either conference rooms or projectors, board rooms. You know, it could be something they could lend you the copier, whatever it is, but they have resources and sometimes human resources and such, volunteers and things that you need to make your program successful. So your community partner is very key in that. I kind of just start with this, you know, and looking at some of your targeted areas. You know, do you have a seat at the table? Are there some amazing community partners out there? You know, just sort of knowing your community. In public health, we talk about how well do you know your community. And I bet if each of you on your board or executive committee, the leadership committee of your PPE at your respective schools, sort of sit around and brainstorm and create a list, you're going to see places and identify agencies that you should really have a seat at this table. And a lot of agencies are becoming more savvy, and community partners, about having, and even churches, you know, having student representation as a part of it. I know here for a couple of major initiatives we're having here at CSUN, for example, Ronda and other student representatives are part of that. They have a seat at the table among the boards and administration. So, and it looks, again, great. It builds your resume, but it also, more importantly, you can advocate for PPE playing a part in that agency's strategic plan and initiatives moving forward. So who is at the table? Is there somebody sort of missing? And what can PPE do to be at that table? Preconception health, as we know, touches so many different facets of life and health. You know, we talk about, even if it's a men's organization focused on the male perspective, well, that's a key component of it, of having, you know, healthy, you know, relationships with healthy husbands, but also the men's health as well in PPE. So who is at that table, and do we have a seat? And then, are you there with a clear purpose? We'll talk a little bit more about this further into the webinar, but you know, you're not sort of just a lot of, you know, Woody Allen said, you know, 90% of life is just showing up. It's not just that. You have to, you know, come and have your focus outlined, you know, of what your specific PPE, your school's PPE wants to accomplish in terms of the strategic plan, and what can be executed with this partner, with this agency. And hopefully your purpose is such that, you know, you have sort of an overarching mission statement of what you want to accomplish with this agency, with this partnership, but it's not so overwhelming that you're going to overwhelm the partner or agency with too many things. You know, in the end of the day, they are a nonprofit normally and not operating from a great deal of resources. They may be strained. So you're there to sort of help them, not just further the agenda of lowering infant mortality and increasing the health of young women, but truly, to offer health education efforts on behalf of PPE, but not overwhelm the partner with too many things that you want to accomplish. A lot of times I notice in public health, and especially when we're young students, we're energetic, we're excited, we want to change the world, and we sort of come in with all of these things to do on our agenda. So it's important to scale down and maybe have the top 2 things that you want to accomplish that year with the partner. So coming with a clear purpose is important. And then, are you getting full? It's the holidays, we're eating a lot. I think I gained 15 pounds at Thanksgiving, and I'll gain another 15 at Christmas, just the way it is. No, I think it even started on Halloween. But anyway, are you getting full in terms of, from each perspective? Is the partner getting what they want? Are you getting what you want, and are both agendas being met? So we'll explore how to do that a little bit further. And who's missing from your network? Is there somebody, maybe even in your partnership, that you're not considering, your constituents? If your needs assessment or knowing your community, and you can look up those statistics, through your census data very quickly. But if your community is, for example, our community here at CSUN is close to, it's between 50 to 60% Latino students, so if we don't have Latino representation on our leadership board, and we are not connecting with Latino partnerships out in the community, there's something wrong, because we're not serving our true constituents. Los Angeles County, in some counties, can be as high as 90% Latino. So if we're missing this whole target audience, what is the reason for that? And we need to readdress that. So establishing community partnerships is obviously, for the reasons I've said, is critical to the success of your program for reaching and engaging key audiences, as I said. But building the capacity, it's the power of numbers, and it's the old ubiquitous saying that it takes a village. If you're connected to one key church, for example, faith-based organization, that has, 600, 800 members, you've just reached through one handshake of that key partner and sitting down with them for an hour with your executive committee of PPE, you've just reached 500 to 600 more people. So that's that type of power in public health, why we are so passionate about this field and the field of preconception peer education, that your message is not just delivered through, being at a health fair is very powerful and important too. You're shaking hands with those in need and you're providing the education. But what's so critical about engaging community partnerships is that one gatekeeper, that one stakeholder has access to hundreds upon thousands of more, of your audience to reach. So, and you're building your capacity through it. You're building your leadership skills. It's more marketable skills for an internship and service learning, and it just furthers the brand of PPE and OMH and clearly disseminates our message out there. The more we need that more and more. And so ensuring successful program implementation as well. Your community partner is going to have amazing ideas about, program implementation and evaluation, and they know their audience the best, as I said before. So they're going to be able to share some of those successes with you. And the more you do it, the more you're engaged, and the more you're networking out there in the community, the more you're building your capacity and building your success, really, for PPE. In the evaluation, when you look at your milestones each month, and in quarterly reports, and at the end of the year, similar to a grant, you can say, hey, we've reached X amount of people, we have X amount of community partners. And that looks important to funders, if you want to fundraise in the future, and also in terms of just building your resources and experience. So I throw these up here, the key strategies for effective collaborations, and it's from the Act for Youth Center for Excellence, and I have the website at the reference slide. But, it's important to recognize the power of time, turf, and trust. Time is of the essence. We're so limited. You guys are students. You only have a certain amount of time. But it's important to consider the partner's time. They have a limited time as well, and how you can come to a mutual understanding of that. The turf thing is interesting. A lot of times it's so much can be said in the unspoken, and having meetings at the partnership site, at the agency site, actually going out to them and taking the time to do so is important in terms of saying, we're here for you, and what you have to deliver is important to us, and we really want to connect with your audience. And in establishing trust, and by doing that, it can be something as simple as meaning what you say and doing what you say. In Eastern North Carolina, I was working on breast cancer prevention among a very, the audience was 90% African American, and I had, 12 years of experience in breast cancer, a PhD, blah, 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 but the community was very small and southern and tight-knit, and they were probably like, okay, who is this crazy girl coming in to tell us what to do in terms of preventing breast cancer? But trust was established. I worked with gatekeepers and stakeholders in the community that were very trusted for years. Church leaders, members of the Chamber of Commerce, just trusted individuals. And slowly the trust was built in such a way that, I was invited to high school graduations, family barbecues, and plays, high school plays and things. And, when I was going to be there and said I was going to be there, I was there. So it took time. It didn't happen overnight. It didn't take forever, but it took, 6 to 9 months for trust to be established. But then once it was like family. So that can be very key in working with your community. You want to clarify your purpose and goals, as I said before. What is this? What does each person want to get out of it? It's good to wrap up a meeting with that. Say, so I understand that you would like this and this accomplished, and we want this and this, so this is what's going to be executed. Establishing a common ground and framework. If the partner seems their agenda may be way different than yours. For example, right now, I have a student working on with a faith-based community, and they want so much. They want a mobile health clinic. They want diabetes prevention, they want nutrition programs, something every week after the church service, and it's just too much on this group of committed undergraduate students. So at this point we have to scale back and say, okay, what are the top 2 things you want this semester, and we will implement them. But in terms of everything but the kitchen sink, we're not able to provide that for you based on the resources we have right now. So it's okay to say no sometimes. The community the partner may be very much in need, but the expectations have to be reasonable too. So identifying everybody's roles and responsibilities becomes important to that. Don't just sort of feel your way and let it happen naturally, but come in with a clearly established set of roles and responsibilities. And then, as we said before, clear communications becomes important. It may be that you identify doesn't always, usually the president has excellent communication skills. That's why they are the president of PPE, of your respective PPEs. And the leadership, same with the leadership, but it may be somebody who has, is a communications major, who has a little bit even more savvy with interpersonal communications, that you might want them to be the identified person, that's sort of your communications chair, that goes out for the handshaking and the community capacity building of these partnerships. So using an open structure and process with decision-making or conflict resolution or anything that comes up, just be very open, but not, again, still ensuring that your agenda is also met. And encouraging participatory leadership, and by that we just mean truly that the community partner takes a little bit of the lead, and we have what we want to deliver in terms of PPE content and preconception health education, but also allowing them to come in and say what format would work best. Maybe they, for example, we've had community groups that have said, well, we want to have roundtable talks. It works best with our African American audience. It's what they like. So that's exactly what we did. I mean, we were ready to go with sort of the PowerPoint presentation, but we put all the presentation material to the side and sort of just had sort of these focused, very nice talks, with refreshments and things. So let your community group tell you what they want. They know their audience best. And then you want to reflect, recognize, celebrate on your partnership and what's been accomplished and executed. We also want to look at, okay, always debrief for lessons learned and anything that's important in life and moving forward. So I throw this graphic up too, is kind of important. And again, you'll have these resources. We'll share this PowerPoint with you, as well as the websites for great resources as you have your kickoff meeting in the spring. And as we kind of said, networking is important. That's the beginning where everything happens. Handshakes are very important, as we know. You guys in this field will be going to more and more conferences and things where you start to network. And really, the area of public health, some of you guys might be in sociology, psychology, allied health, and nursing, medicine, but it can be a very small field when you're in your specialized field. So it's important when you're doing those handshakes, even at as young of an age as you guys are, and that it could be that one handshake that says, oh yeah, come to my agency and present, as easy as that. Coordinating is important. Collaborators exchange information and are willing to alter their services or program activities to achieve the common goal. So, some of your agencies might coordinate their service delivery or how they interact with families or something in the community a little different. So knowing that is important and changing accordingly. And okay, and collaborating is important as well. As we talked about, collaboration is key, and people have expertise, don't forget. And don't underestimate your expertise, even though you say, well, I'm only an undergraduate student, I don't have my degree yet. No, you have the student's perspective. You have a leadership perspective. You have just being at the table and being PPE trained and certified through OMH. You have an amazing level of expertise to share as well. So don't underestimate that, but also don't underestimate others, or share challenges or risks you might be experiencing, and don't underestimate others' expertise. If they have expertise in something, bring them on board. When we worked in East Carolina University, Karen Inori, who was the president at the time of PPE, had said, she wasn't afraid of, calling the top pediatrician, who worked with, low infant birth weight babies, and of our medical school, and saying, hey, can you come on over and give a presentation for us, an informative training? And it's sometimes just, not being afraid to make that phone call, and there can be amazing partnerships that come from it. And then integrating, when collaborative partners or agencies work closely and efficiently together, you're operating from shared administrative structures and resources, which is always a good thing in this budgetary time. So kind of just see that, where you kind of get a glimpse of that. So the 7 steps to establishing community partners, and this is what I kind of came up with. I teach program planning and things, so hopefully you'll get a little bit out of this. If you haven't taken sort of a community health or a planning course in your major, some of the stuff, please feel free to use it in your courses when you do take one. And again, this is from the toolbox at University of Kansas, but taking action in your community is important. You just look at the simplistic model. You want to assess. There should be at least baseline assessment going on in your community to know who your partners are, but most importantly, where the health issues are. What are your demographics of your population? As I mentioned, our population in terms of the Latino demographics. So what are your actual demographics for your different populations, and what's going on in terms of your health issues and your infant mortality rates? Being PPE trained, you should just know that automatically, and it just can be a baseline assessment, and reinforcing that to new members of the PPE team. Then you want to plan for the action, plan it out. What are you going to do? Are you going to just call and have meetings? What's the next step? In terms of if they say they want a very robust program, they might even want something as integrated as an intern or service learning opportunity where they have somebody there for 10 hours at the agency. So are you ready for that? Is there somebody, do you have the resources to do so? Then you're going to act, which is basically implement the program. That's the exciting stuff, right? That's the things we kind of love doing, connecting with the community, presenting, and doing stuff out there. So that's the fun stuff. Then you evaluate it. Like I said before, debrief with your team what worked well, what didn't, and ensure that your community partner's there as well to kind of add some insight and say, well, this was good, but I think we could have marketed it a little bit better. One of my student groups, too, they were, implementing a program, a preventive health program and diabetes program in the community, and they only marketed it about 4 or 5 days before. So make sure that your marketing efforts are well in advance, or know your population and the constituents and how to promote things. It's something that simple, but evaluating what worked, what didn't, what you do next time, and then sustain it. You want to sustain these partnerships. Say the thank you. Invite them to any of your, PPE events that are more open. They might have some community leaders that are and key kind of volunteers that are really, they might not have anything to do or might feel disconnected and might have a true passion for PPE. So inviting them to be at the table, even with your campus partnership, will be important too. You're sustaining long-term relationships. It's not just hit it and go with a presentation of PPE and then go, and then it's back to the circle and assess. Okay, so first, again, you want to sit down with your leadership and executive board and plan what communities should be targeted. I hope you guys will do this in your kickoff meetings in January and sort of sit down and just brainstorm and create a list of what partnerships, agencies, as we talked about, faith-based communities, worksite wellness, don't forget about that. That's a key area where you can hit. Many, small businesses are still considered, 500 and less employees. That's still a lot of employees to hit. So you guys could do lunch and learns and things like that. And then agencies like the March of Dimes, and things that might turn into also funding opportunities, through small grants or whatever it is. So as I talked about before, what are the data and needs assessments that you need to support your initiative? And then considering any existing connections or partnerships you have. So brainstorm and list. You can't even believe what kind of list you can come up with. We did that at East Carolina University because we wanted to do a multi-pronged approach in terms of our outreach. We wanted a community approach to the barber shops, nail salons, and beauty shops, and sort of the classic community partners. Then we wanted a faith-based initiative. A student took the lead on that he was involved in a very large mega church, and so he could take the lead on that and was very actively involved in his youth ministry. And another student was a worksite health promotion major, actually, so had some connections with some workplaces there in North Carolina that they could reach out to. And so different partners for different needs, but you can really hit a broad array of areas. There could be an internship, like I said, or a volunteer somewhere where you had some sort of connection. So plan it out and do some good brainstorming on that. This is an example of a community assets map that's also provided by the youth agency that I spoke of before. But, looking at local institutions, what are different schools? Ronda's going to talk more about partnership that we've had with other schools and other colleges, but human service agencies, we're just truly, health-based nonprofits are really fine in our case. But businesses, parks, we have a park here that is amazing. They provide us with a free room whenever we need it. And it's in a very disadvantaged area of Pacoima, which is a bit challenging in terms of the population is definitely in need, and there's a high risk of infant mortality and teenage pregnancy in the area. But it's for the room for us to rent, had we not, sort of said the handshaking and who we are, would be actually $200 to rent an hour. So they provide that for free. Also, Northridge Hospital has auditorium rooms with real nice high-tech equipment and flat screens, and they're like, we allow that for any of our community partners. And so, sort of what can be provided low in cost, again, with that partnership stuff is so valuable. I mentioned churches a lot, and then elderly organizations too. I mean, it's not as much for us and our key constituents, but you never know what might be a resource in the community. So think about what individuals may provide from a volunteer basis and things. So that's kind of interesting, and obviously your student clubs that you'd be collaborating with. Okay, so step 2, where do we need to go? This is where you want to reach out to the respective organizations in the area for a kickoff meeting. It's exciting, and it's something that we do a lot of public health. It's just collaboration is key. That is one of the basic pillars of public health, because again, you don't want to recreate the wheel. There's power in shared resources and everything that we talked about before. So you're going to look at your target audience, and here's some examples of what you want to start looking at that I talked about before. Nail shops, barbershops, hair salons, nonprofits, specifically focused on Latino or African American organizations ideally. We talked about March of Dimes, women, infant, child, WIC programs could be great. Public health agencies could be your public health department. So you have key organizations that it's now time to contact them and do some of the handshaking. And healthcare agencies, again, like I mentioned before, hospitals are becoming more and more savvy on providing preventive care and hiring actually diabetes educators and maternal child educators and lactation consultants and educators and things. So partner up with them as well. It's a fantastic way to reach a great number of our audience and have great resources as well. And then again, your school organizations on campus. So you can think of other ones as well. So communicating with your partner, here's just some tips for success. And we also provided some handouts, in terms of individual and community asset mapping and tips for success on communicating with your partner out there. But again, I talked about be clear about your purpose. Choose an effective facilitator. This might be somebody, again, with a communications degree, somebody who's just savvy. You know who it is, who you work with, and who has just good communication skills. These are the type of people that could sell ice to an Eskimo, and that's important because they are the face of PPE. They're the face of your university. They should bring with them things such as a brochure, information about PPE, maybe a short, video. One of our board members here created a short video on the unnatural causes video that we've also seen in the PPE training, and is a very powerful video on infant mortality, the disparities of infant mortality. But we have a little 4-minute clip of it, so the partner could see that and be very sold and excited about the mission of PPE. So, again, but also, if your PPE organization might want to consider having a newsletter, or it could even be a little e-newsletter, but something that's updating the PPE staff, and your partners can be included on those mailings as well. And just getting them real involved and feeling a part of it. They might be so busy that they're only able to attend one thing or nothing, but it's just important to have that continual process of engagement that we talked about. Listservs and websites become important too. So then, obviously, you have the meeting. You have a meeting with your community partner. If it is feasible to drive to their site, as I mentioned before, you're going to bring the information, like I said, on PPE and the Office of Minority Health, and share what PPE can provide to their citizens and constituents. How will their community? You need to really sell them, even though you're selling them something that's free and it improves the lives of their community members. They need to be convinced because they've got their agenda and they've got their strategic plan to execute. So what can you provide them? And it's obviously the health of their citizens, but it needs to be something a little bit more. And that is truly resources, and improvement of their outcomes. Incorporate what community partner wants to accomplish. Like I said before, it's very participatory. Consider revenue generating opportunities. There might be, again, like we talked about, like the March of Dimes has the small grants program. There might be other revenue generating opportunities. Our public health in North Carolina, our Department of Health and Human Services for our state was actually able to provide us some seed funding, which was really key. They just jumped in and came on board. So you never know what funding opportunities might be generated from little grants, but also even for-profit sponsors. It might be, you have you're in Minnesota or something, and you have a program that there's headquarters. Think about with your worksite wellness, where you're doing some handshaking with maybe General Mills or Yoplait or some sort of headquarters that also meets the agenda of PPE, or really supports health and wellness, or it might be a gym or something like that, and you're doing some handshaking. They're able to offer things like incentive gifts, free memberships for your next training, or just refreshments, whatever it may be. Nothing is too out of the ordinary in terms of sponsorship, and in this budgetary climate, we have to be thinking of how we can get further resources for PPE. Can we get folic acid donated? If it's something as simple as a $50 donation, that can go very far for your training efforts and needs. So you want to agree on an event that is suitable and can be supported with your current PPE board members, as I talked about. Nothing too large, but something that you're excited about and you can really get behind. And sometimes, this is kind of formal, but a letter or email of agreement, just so everybody's on the same page, maybe bulleting out what's going to happen, the date, the time, and what's going to be accomplished can be very good, so everybody's very clear. So then you reconvene again with your PPE board members and members of the key PPE planning committee and those who are going to do the health education and plan the program implementation. There's not a lot on this slide because each curriculum is, and what you're going to deliver in terms of content is so specific to what your community partner wants, the target population. We have obviously OMH and PPE program has shared with you a plethora of resources and everything you could ever want and more in the toolbox, and you have content, even sometimes state-specific content or general regional content, so you have things to pull from. But in terms of your presentations and the health education that will be delivered, so you want to consider also the personnel required. To err on more is better. More hands on deck can be a very good thing, and that your community partner will be there. Equipment, curriculum, incentives, budget, those are all things you want to be considering as you're considering your content. So then you obviously implement the program, and that's the exciting, the fun stuff, see how it goes. Hopefully it's not too involved, and it's something that is based on a best practice like we talked about with the barbershop and beauty salons, nail salons. You know, there's best practice programs out there that are very effective that you can build on. And then evaluation is critical. You know, you want to be looking at things like, if people are always like, well, how do you evaluate if a program is successful? And we scratch our head on that. Evaluation is something that is key in public health and in research, because how do we know something was effective, right? Is only through evaluation. So we want to evaluate attendance as one mechanism, an easy mechanism. But, you know, you never really know how much people have gained information. So there's pre and post tests for knowledge, and I have some that I can share with you guys if you need some, and some that are from like the Lance Armstrong Foundation and stuff that are good to get you started. Very simple 10-item, you know, true and false quizzes essentially on the content that you're covered. You administer it before you administer the content and then after, and see if there's a difference, and usually there is, and it's very rewarding to see that increase in knowledge. And then you want to debrief with your community partner on what worked well, what didn't, and you know, with your PPE board members that were in attendance and PPE presenters, and talk about what they'd like to accomplish moving forward. And don't forget to send thank you notes. I think that becomes very important, and we forget to do that in this day and age. You know, we're so high tech and stuff, and there's nothing like a handwritten email card, card that's signed by all members of PPE to say thank you to your community partner and keep that relationship established. And so finally, the last is to nurture partnerships. You want to invite your community partner to future events, as I talked about before. Keep them engaged, receiving emails, continue correspondence. Decide on what next steps. Don't end it with, okay, yeah, we did this fabulous presentation at your church, you know, but what would you like to see next, you know, and be reasonable in your timeline. You guys are students. You're so swamped and being pulled in so many different directions in terms of your classes and PPE and work schedules and all of those things. So just also come to an agreement with your partner on what's reasonable, and hopefully it's tied, you know, to some greater initiative. Brainstorm with other PPE leaders on what works, what you like to do next, and where you guys need to focus next in terms of your needs assessment and data. And always be looking for the next partner. Have that elevator speech on PPE ready, and that's something you can basically, what we say with elevator speech is something that if you get into an elevator, you press the floor you're going to. If somebody said, oh, PPE, I've never heard of that. Tell me a little bit about PPE. And you're able to just, boom, in a few sentences, sell it to them, you know, and give them a background of what PPE is, the health disparities of preconception health, and what you're doing and from an organizational perspective. Or have even little business cards printed or a brochure ready to give someone, because you never know. You might be on a plane, you know, you might be walking around campus with a professor. You never know who that next partner is going to be. And don't be afraid to advocate on the program to even elected officials and higher ups. You know, make an appointment at the Chamber of Commerce, even the mayor's office. I mean, and contact your local legislatures to really get PPE's name out there and to get resources and funding. And again, you know, as I talked about before, we're under a very strained economy. Here in California, we're one of the most strained economies in the nation, but we all are. These are tough budgetary times, and in that, partnerships become essential because you're sharing resources, and it's the power of many that create that change. So that's what we're doing here in addressing this complex social issue. So I now hand it over to Ms. LaRonda, who will take it away and talk about from a more best practices perspective here at CSUN.
Well, thank you, Dr. Burke. So I'm going to talk a little bit about branching out. We're going to focus on staying within your campus, but also going off your campus. One of the things that CSUN PPE did was to start off. In the beginning, I know it's overwhelming and you kind of want to build relationships, and as Dr. Burke kept saying, networking is very crucial for the PPE program. So when we kicked off our PPE program, we started with the health fair, and that's a good starting point for the PPE program because you develop relationships with a lot of community organizations, and that's kind of where you get your campus involved, gaining buy-ins from other campus organizations. You don't want to forget about your campus. There are excellent resources within your campus. I know for CSUN, we actually have programs that are solely based on community service efforts. So you want to contact organizations like that at CSUN. They're United We Serve, and what they do is they go out into the community and they find what different areas are in need of, and they try to provide those services. So CSUN PPE linking up with those organizations were very beneficial for us. Another one of the things that you can do is check your own neighborhood, your surrounding area. You want to go out into the community, but you also want to find out what's in the immediate surrounding areas of your universities or your colleges. So you research those communities and you find out exactly what do they need first. Once you know what they need, then you want to try to build some kind of program and link up with organizations that can offer those sources and things that they need. Another area that you can check with is your own home within your families. You talk to your family members, find out what organizations they're involved with. I'm a parent, so I have kids. My kids go to Boys and Girls Club, so those are different community organizations that you can link up with as well. Like Dr. B was saying about the nail salons, we all go to the nail shop, we all go to the hair shop, different barber shops and things like that. You want to check within your community, use what's close to home. Another good source would be if some of your PPE members work in organizations such as hospitals, medical centers, doctor's offices. All those are key for the PPE program, because what you're doing is you're building relationships with as many people as you possibly can, because at the end of the day, we're all going to need that assistance and we're all going to need that help. We need someone that we can call on and say, hey, for me, I work for Kaiser Permanente, and what I did was for our health fair, I went to the health education office and said, you know, we need different resources. I'm having this health fair. Can you help us out? And so they were able to provide not only a speaker for our event that worked at Kaiser, but they were also able to give pamphlets. They were giving out DVDs, so many resources and so many things that the community needed. Attend community meetings. You want to develop relationships that way too. So if you know that there are church organizations or community organizations that have weekly meetings or monthly meetings, you want to go to those meetings and find out, you know, what they're doing in the community, and introduce yourself, because what you're doing at that point, as Dr. Burke said before, you're selling PPE. So you're introducing PPE to them so they can get familiar with you, and you guys can link up and have different health events and provide services for the community as well. So we can go to the next slide, Dr. B.
Okay, sorry.
Yes, okay. So one of the partnerships that PPE started off with was March of Dimes. And when we all went, we received March of Dimes training. This is going to be beneficial for you as well. You want to become familiar with different aspects of preconception health and different aspects of community organizations. So if they're offering training, all you're doing is you're building on your knowledge that you have. So when you go out to the community, you can talk to them about preconception, you can talk to them about infant mortality, but you also have backgrounds in other areas which will be beneficial for them as well. So developing those relationships with different organizations within the community is a way of branching out beyond your campus campus as well. You have to be, you can't be afraid to, leave the university, and that was one of the issues that we had in the beginning with our PPE, is that we kind of stayed on CSUN campus for a while, and we were kind of scared to step out in the community. But once you get developed, and time will tell, and you'll see, relationships are very key, and stepping out into the community is what we're all here for and what it's all about. So as I said before, branching out does matter, because you're going to develop those skills. You're going to receive training from different organizations as well. Introducing the community to PPE, another way to recruit, because I know once people receive PPE training, sometimes your numbers can drop, and you need, it can't be, a two-man show. You kind of need the membership in order to be able to go out, because we're students and we're swamped with so many different things. You gotta have to, separate and say, you take this area, I'll take this area. You take this hospital, I'll take this campus or high school. So recruiting is going to be crucial, and once you go out into the community and introduce the community to PPE, what you'll run into is that there are students from your campus that didn't know about PPE and possibly can become members. So you'll also be gaining members going out into the community as well. And then you'll work on future events. So about you meeting community organizations and talking with different people. Maybe that person is interested in finding out when your next event is going to be, so they can come and they can be a speaker. They can host an event at their site. They can donate to you different, if it's not a monetary donation, that's fine. Maybe they can donate cases of water, or they can donate different DVDs or pamphlets or brochures. I know for one of the events that we had, we used Walgreens, and Walgreens came out, and they had so many different giveaways and things that they handed out to the community about diabetes, about high blood pressure. So you want to branch out to beyond your campus. So this is one of the events that PPE recently had. We started off with the health fair last semester, and then this semester what we did was we went off campus and we went into the high schools. The high school that's adjacent to CSUN had a health fair, and what we decided to do was to go there and introduce ourselves. This is also a networking opportunity, because when you're there at the health fair and you have your booth set up and you're telling everybody about PPE and you're talking to the students, you want to look around and see all the other organizations and partners that are there as well, because those can be potential relationships that you can have for your future events. So one of the things that we did was, while we were at the event, working the event, we also networked. So, it's killing two birds with one stone. You're there and you're talking to students, you're talking to community members and parents, but you're also talking to community members as well.
Okay, wonderful. That was excellent, LaRonda. Absolutely fantastic. And to see PPE, CSUN's PPE in action and successful in the community. And LaRonda is actually very humble. They've been amazing at raising thousands of dollars in terms of fundraising for PPE, and really getting out there in the local community. So, but we kind of leave you with this quote that I think kind of resonates very well. But for a community to be whole and healthy, it must be based on people's love and concern for each other, by Millard Fuller. And I think it just summarizes this so well. We can't, it's just that sort of, Hillary Clinton thing, when we look at it, takes a village, and it really does. Healing, health, wellness, preventive care, and preconception health, ideal health, cannot just be with one person, and it takes an entire community caring about one another. And in this technology age, where we're so, sometimes I'll see students walking across campus, and they have their iPad and they've got their iPod in, their headphones on, earbuds on, and I do the same thing. I'll be texting and walking in the doors and halls and walls and on campus too, but we really need to put that down and take time to be with the community, and we're only as strong as our partners and each other. It's not sort of a one-man show ever. And the most successful programs, if you go all the way up and you look at some of the Office of Minority Health's key programs, not just preconception peer education program, but others, are based on the pillars, National Institutes of Health, all of our big agencies that have changed lives for the better and extended lives and prevented morbidity and mortality have been based on collaborative partnerships and the power of an entire team making a difference in people's lives. So we thank you so much, and there's our contact information should you want to get a hold of LaRonda or myself. And we now open it up. Again, thank you for all you are doing and your hard work and efforts out there in the community on behalf of PPE and the Office of Minority Health. We now open it up for questions, and back to our fabulous moderator, Denise.
Well, that was actually a very excellent presentation. Thank you very much. And thank you everyone for joining us once again. We know it's an awkward time at the end of the semester and everybody's really busy. So like they said, if you have any questions, just go ahead and start posting, and I'll read them out loud to our speakers.
Don't be shy, guys.
Yeah, don't be shy.
And again, we'll be sending you the handouts and a copy of the slide deck, too, for you guys.
Ms. Valentine, sorry, you want to ask something? Ms. Valentine? Winona? I unmuted you, so I think you can talk. Okay. Okay, well, we have a question. It says, what are some ways to encourage fundraising with new chapters?
That's key. Ms. LaRonda, you want to take that away?
Fundraising. I think what's key is collaboration. You want to find out, well, first of all, find out if there are different venues within your area that do fundraising. I know CSUN, surrounding areas, all the food places, pretty much they do fundraising. Actually just had a fundraiser last weekend at our local skating ring. So things like that, you want to think about fun things that students are going to want to go to. Anything that has to do with food would be fabulous for students. But collaboration would be good. We linked up with our organization on campus, Health Administration Student Association, and we worked with them to actually bring in more numbers. And what we did was decided to split the profit down the middle. So the same thing that you would do if you were in a church organization or any kind of community organization where you're trying to do funds, go old school. Do a cookie sale, brownie sale, ask people for money. You can't be, too modest to beg, because that's exactly what we did. We went from all the different offices and pretty much told them about PPE. We asked if they can help us any kind of way as far as funding. We went to the provost's office. We went to different departments on campus. We went to our department chair. So you have to ask. I mean, the worst that people can do is tell you no, but I'm almost positive once they find out what the goal is and what the mission is, they love to see students in action. So once they find out exactly what you're doing, then most of the time if they can help you, they will help you. If they can't help you, they'll send you to someone else that can. So I would just suggest that the first step that you take is just to ask for help.
Excellent, LaRonda. And I just further add in terms of don't be afraid, like LaRonda said, but also just don't feel intimidated, because a lot of like grocery stores and some of your more for-profit community partners will have like an online submission form, and it'll be like, they'll say for sponsorship opportunities, fill out this form online. But don't be afraid, you'll have the information on PPE, or you can get that from the OMH. From your key contacts, and cut and paste the information in there. And just it might be important too to designate a sponsorship chair on your PPE board, or a sponsorship and fundraising chair. You should have someone who's savvy in that and not afraid to ask, not afraid of rejection, but willing to knock on doors and handshake and stuff. And and think of diversified funding resources, you know, like LaRonda mentioned Walgreens, you know, just various areas that seem to match, though, PPE's mission, but no, everybody's got something to give, you know, whether it's an incentive or whatever it may be. And like we mentioned before, you know, work with your hospital foundations or March of Dimes to get small grants. Don't feel overwhelmed, but starting with, you know, few $1,000 grants, $5,000 grants could really be helpful and could move, you know, PPE to that next level. But have someone that's, I think, as a board, it's important too, as a new PPE board, to, just as we said, identify key partners in the community of where you want to go. Identify key sponsors too. They might be one and the same, but have a list of maybe 5 people that you're going to reach out to and submit an online submission for form, you know, for request, and also that you can beg them for a meeting, you know, and bring the information on PPE. Yeah, follow up. Don't let it go.
And that, you know, that was one of the things we did too.
We have 2 other questions. It says, what have been some challenges when approaching community agencies?
I think sometimes it's just that they're too busy, you know, and they might, you know, I think it's important, you might want to work with your faculty advisor to, I think LaRonda and I had that situation a couple times where it's like, okay, CC me, or when you're going to reach out, CC the faculty advisors. We're kind of going through a situation like that right now where we're engaging other student groups, but you need to, so they know that it's the real deal, you know, and if they don't feel that, oh, this is just some random person off the street, you know, so that there is a formalized system, that they're representing the institution, and but some of the problem is just simply a lack of time, or you know, but usually you're going to find overall, I mean, 9 out of 10 times, you know, that again, when we're focused on the greater mission of the community and helping others, you know, public health is a very nurturing profession, and preventive health. So your community partner is going to be pretty open, you know, even if you're reaching out to somebody as busy as like a healthcare facility, you're going to see doors open, and don't be afraid. Don't be afraid if they're not completely open or it takes time. Like LaRonda said, follow up, keep on with the continuing email. Don't send just one email and say, oh, I didn't hear back. You know, that's what I tell my students all the time. Send an email, send a phone call, be persistent. You're going to feel a little bit stalkerish. You know, I mean, obviously you don't want to be sending them 100 emails, but you know, you're going to know when they're completely blowing you off, and at that point just move on. But I think having that they know it's a formalized system, that you're representing the institution, the OMH, there's a faculty advisor CC'd, you'll get your foot in the door. You're going to find it very rewarding, and it feels amazing to be at the table with some of these community partners. LaRonda, did you have anything to add?
I think one of the key elements would be that you should be chartered as well, so that you can receive that support from your campus. Like Dr. Sloane was saying, you want to make sure that everything is legitimate, so meaning that you want to have that campus name attached to PPE, and that was one of the things that we did that I think was beneficial for us, because when they recognize that you are affiliated with your campus, then they'll be more willing to help you. So you might want to think about becoming a chartered organization.
Yes, that is so key, LaRonda. So you go through your associate student union or whatever the mechanism is at your respective universities to have that. And it's a great source of funding, too. LaRonda, we get little bit startup funds, right, annually from associate student union. And that you guys are paying, yeah, you guys yourselves and every student that you're with is paying student fees to the student union. So why not take advantage of some of those fees that come back to the student group? So apply for that. It takes time. You know, Ms. Karen Inori, who was my former advisee to the president of PPE at ECU, and LaRonda, they both had to go through that, writing the bylaws, putting it all together, presenting to ASU. It's a big thing here at CSUN. It was a big thing it's at ECU as well. They're just sort of like, you know, come at you with all these questions, but it's so worth it, because then you're now formally recognized by the
and you get money. You get money each year. You apply for money, and they give you money for each organization, so it'll be beneficial for the group at the end.
Yeah, not every university offers that, but many do, and it's great initial funding. So.
Okay, so next question says, I wanted to know how we as a community partner remain in contact with the PPE. For example, Ronda used our photo. We are a regional trainer for the March of Dimes curriculum. How can we come on campus? Other ideas for us to become involved?
Yeah, Ronda, March of Dimes and integration and
I would say just stay in contact with the president or the executive board members or anyone that you have contact with from that group. You want to stay in contact with them each semester, and then also ask the community organizations too. The actual PPE members, the e-board, should be sending updates because the board members change. So with each semester, there may be a shift in board members. Students come in and they leave, they graduate. So I kind of think that it may be up to the PPE executive board to make sure that you guys are aware of those changes so that you guys can stay in contact.
That's it. Keeping the contact and the communication lines open and how we can support that community partner even further. March of Dimes is such a perfect partner on so many levels. It just makes perfect sense in terms of the mission. So how can we take that to the next level? Can we offer you service learning students? Can we offer you internships, you know, and that further integration? So, yeah. But,
and then one last question that I have here is, what are ways PP can retain student membership?
That's a good question.
I know with graduation rates and
that is a good question. Start off young. You want to recruit members that are freshmen, and we've been learning that a lot with our PPE organization at CSUN because when we first started, I believe more than half of our members were graduating seniors, and so we had to start all over from the beginning. And so I think the best, like what we're going to do in January is we're going to go to like freshman week. We're going into the dorms. So when you start off with the freshmen, at least you know you'll have them for the next 4 years.
Yes, that's the key, Loretta, that's the key. And so starting young, and I think the faculty advisors too, continually promoting it and supporting it. For the certification, I provided extra credit to my students, and I actually got my graduate students engaged because they kept sort of saying, oh, I don't have anything on my resume that, you know, that it's in public health. I'm working in this field. It's not even related to public health. I said, well, we got an opportunity for you. We have them here for 2 years, and it's a very commuter school. They work during the day, you know, but there's, you know, the PPE things are such that it's on weekends and evenings, so there's no reason they can't become involved in the PPE effort. So don't underestimate, too, your graduate students or promoting the program to other majors, you know, psychology, sociology, business, speech communications, whatever it is, it's a good fit, too. You know, so many people are interested in preventive health that aren't your typical, so extend way beyond your major and ensure your reach is really broad in both undergraduate and graduate students and in different departments and majors.
Okay, well, those are all the questions, and I definitely agree with what you guys said. Start out young, because we have noticed during trainings, most of the students that go to the trainings are always juniors and seniors, and then we never hear from them again.
Yeah, if we had a full solution for that, that would be the key, that we'd be millionaires, because I know that's always the problem in all student groups, you know.
Yeah. Okay, well, once again, thank you everybody who joined us for this webinar, and thank you ladies, you did a great job. Thank you for all the information, and our next webinar is in January. I have the date. I'll send out an email, and once again, thank you.
Thank you,
guys.
Denise. Thanks everyone for participating, and keep in touch with us if you need anything.
Yes, please email us.
Happy holidays.
Happy holidays.
Happy holidays.